This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time.
March the 11th, 2020, and the World Health Organization declares a coronavirus pandemic. 118,000 cases in 114 countries.
It's actually hard to believe, and so much has changed. We wear masks all the time, we're constantly washing our hands, we can't hug our friends. Our children haven't been to school for months on end. Some people have had COVID and not even noticed. Other people, and we know this, have died. So now is the time to ask what lessons can be learned, but also, more importantly, is there hope?
We had already seen the pictures from Wuhan in China, the epicenter of the outbreak. We had seen the patients in Italy, faces obscured by machinery, prone on their stomachs and dying in waves. In the UK, 460 people had tested positive and there had been 2 confirmed deaths. The Liverpool Atletico Madrid Champions League football match went ahead at Anfield, as did the Cheltenham Festival. The government and advisors insisted it was safe. On the 9th of March, Professor Stephen Riley submitted this paper to the government's scientific advisors, calling in the starkest possible terms for a lockdown. That, of course, did not happen until a fortnight later.
Tell me what was going through your minds when you wrote this paper.
I felt that some people thought there was an option that we could just let this pass through in some way and get back relatively quickly to normal life.
Herd immunity.
Yeah, I certainly don't remember that kind of being, stated, but it was just the idea that, that we had to try and get through this, and that it might be quick, because I didn't think there was any fast option. So I wanted to make that point really clearly in the paper.
A WHO meeting in February to find ways to slow down the virus. Professor David Heyman was there, a leading authority on infectious diseases.
One of the major lessons we've learned is that the world did not want to work together in this pandemic politically. They worked together technically very well. There was a great exchange of scientific information and great research and development activities, but countries just didn't politically want to work together and cede their sovereignty in order to do that.
That's the science and the politics. And then there are the patients, the victims, and those like Dr. Natalie McDermott left with what's called long COVID.
I have some sort of damage to my spinal cord which affects my ability to walk very far. I can't drive at the moment. I don't believe I can drive at the moment. And just even doing things daily around the house can be a struggle.
And every day the numbers climbed further still. But there have been developments, scientific breakthroughs on a monumental scale.
The biggest achievement I think that we've made is that colleagues have developed a vaccine, the NHS has, and the companies have produced these vaccines, and we've got them into people's arms, into at-risk people's arms, before those people got infected. And then kind of going out to the summer and into next autumn, the biggest uncertainty is about the evolution of the virus. We know that it is evolving. We know that it is evolving to escape immunity to some degree. What we don't know yet is how good it is at doing that.
Will it become endemic? Will there ever be an end to it?
Well, I think nobody would argue that this infection is now becoming endemic and will be with us for quite a while. We have some excellent tools to deal with it. We have vaccines, we have diagnostic tests, we have some therapeutic drugs that are coming along, and hopefully they will be available. So we will have to live with this using the tools we have.
Sometimes the tools have worked, tocilizumab and dexamethasone as an example, but not hydroxychloroquine, to the disappointment of President Trump. Still, numerous questions need answering, not least why has the UK done so badly. Few dispute the need for an inquiry, and the government says it will happen, though refuses to put a timetable on it.
Many people have suffered in very different ways, and we're sat, just about to come out of the third lockdown. So I think people do need a really good answer to that, but I don't think now is the time to try and give. I think we need to get back to a period of very low circulation of the virus, so that we can look at that question properly.
What has surprised you the most about this past year?
I think what surprised me the most has been the lack of attention paid to the science in many countries. Hopefully, in a future pandemic, there will be better links between the political and the public health community so that together they can make the right decisions.
1 year on, and the numbers are now astonishing and distressing.
Obviously, I hope that I'm going to make a full recovery, but from my perspective, I'm going to need quite intensive physiotherapy. I need support at the moment just with things around the house and gaining some of the function back that I've lost.
When the WHO declared the pandemic on this day a year ago, they also asked for unity, clarity, empathy and determination. History will now be the judge.